What is cervical cancer and how do you diagnose it?
Yes, cervical cancer is the cancer of the neck of the womb of a woman. Every woman has got a womb, and the neck of the womb is the opening. And for practical purposes, it's designed to have a hole there to allow a period of a woman to come out. If the woman is lucky and has sex regularly, the sperm will go in through the cervix to go and fertilize the eggs. And when a woman gets pregnant, the cervix has to open to allow the baby to come out. And more importantly, close, so that the woman will not bleed to death.
Very well.
And guess how they get it?
Through the men, yeah.
From us guys. Wow. Because we've been blessed with this gift of HPV as a normal flora on our body. It doesn't do anything to us, cannot penetrate. But when we penetrate women, we transfer the virus to women. Right. And that's our gift to you. Sadly, women don't know this, and therefore they are not prepared for this diagnosis. So when they start having symptoms, doctors are helpless. But thankfully, about 4 decades ago, a Greek pathologist called George Papanikolaou, discovered that if you can check the woman's cervix throughout her reproductive life, you can detect the abnormalities on the cervix before it develops to cancer. And that's from the basis of the developed world screening all their women and doing the so-called pap smear.
What are the symptoms?
The commonest symptoms are discharge, which are really not specific. A lot of women discharge, but this one will be offensive, they never go away, and at times they are bloodstained. Women bleeding all over the place. Women, you're supposed to bleed during your period. That's why we call it a period. You bleed, you stop. You bleed, you stop. But if you're bleeding all over the place, that's a very, very red flag. And more importantly, if you bleed after sex. Women shouldn't really bleed after sex, and that is not acceptable. If you discover something, we can do something about it. When women come for screen, they think you're going to find a cancer, but we are not. We're going to find precancerous lesions, which is what you were trying to say earlier. And these lesions are things that, I use a big grammar there, but they're just changes. Cervical cancer is one of the very few cancers that behave like this, that gives you about 5 to 10 years before it can actually lead to cancer, another 5 years before it can kill. That's why it's such a long disease. So,
now, when you find out they're positive, what's the next step?
Positive means that you have changes on the cervix, not cancer.
Right.
So that means a doctor who is trained to deliver a treatment, and the treatment is usually either freezing the area so that it can burn it off, because very extremes of temperature can burn the cervix, and then gives the cervix an opportunity to heal, and new layers of cervical tissue will grow over it. Then we can either remove it too, if that doesn't work, using electric wire under anesthesia. It's a more specialist procedure. We call it LEAP. And then we can give the women vaccination. Because after you've treated it and she goes back and she's lucky to have sex again, she will get infected again. So you have to give them the vaccine. And talking about the vaccine, the original motive for the vaccination was meant for pre-sexually active young girls. But research has now shown that all of you, if you are lucky to be having sex, will be infected too. And therefore, you must protect yourself.